Robin Nijveldt, Mike Gibson coming to you live. Fascinating concept here, Robin. We're talking about MRI-guided revascularization of non-culprit lesions. Talk to us about what you did and what you found.
Yeah, so I think it's a nice pragmatic study where we looked into patients with an acute microinfarction and non-culprit lesions to find out whether the immediate, angiography or maybe physiology guided strategy would be better than a deferred strategy. And normally they would do nothing in a deferred strategy or compare to exactly the same procedures immediately versus deferred. What we did is we chose a non-invasive method, not to do a second invasive procedure. And in our case, it was cardiac MRI. So we chose to check whether immediate, as it is stated in the guidelines these days, would be superior to the MRI guided arm, as we did it in the deferred group.
And what were you looking for on the MRI to guide you?
That's a very good question. So we did it very clinically driven. So you had the knowledge of the angiogram. You looked at stress perfusion imaging, looking at perfusion defects, besides the infarcted area that was infarcted due to the primary event, of course. And then you could separately see stress perfusion defects caused by ischemia and the other stress perfusion defects that were caused by an infarction. So you could clearly separate the two, given also the information of the angiogram, and then a decision was made.
Robin, I got to say, in the past 2 years, I looked at 2,500 STEMI films running a core lab. Oftentimes, I think people get the culprit artery wrong. Did you ever see that the non-culprit was actually the culprit?
I think this is a very excellent remark. Specifically in non-STEMI, a major number of cases, they chose the wrong culprit lesion. I think in this setting where you have an acute STEMI with ST elevation, with predominantly RCA and LAD infarcts, it's quite clear that a coronary artery was occluded. So we were not surprised, even not by the MRIs. They both fit the right schedule. Culprit was culprit and non-culprit
Yes.
was indeed the non-culprit.
So what did you find? Did the MRI guided approach change things?
Well, I think so. We thought that an immediate strategy would be better than the deferred strategy, but we didn't prove that. And it seemed that both strategies were comparable. So we did not prove superiority of an immediate IFR guided arm compared to the deferred MRI guided arm.
And how early was the early strategy?
So the early strategy was immediately. So during the primary event, the patient was asked for oral informed consent, and immediately an IFR measurement was done. And if it was 0.89 or below, they would do a procedure immediately after the first procedure. In a few cases, it was done within 24 hours, but in the majority of cases, it was done in the same session. And the deferred strategy was done within 6 weeks after the
6 weeks.
acute MI. Yeah.
All right. Well, this is what happens. We have hypotheses, we test them, and we learn the truth.
Yeah.
Great study. Well done. Thanks so much for joining us today, Robin, and thanks to all of you for joining us here.
Thank you.